Our next session provides a healthcare provider view of the pandemic. I am pleased to introduce to you Sarah Cravens, the CEO of SutterHealth since 2016. SutterHealth provides care for more than 3 million patients across Northern California. That is 1 in every 100 Americans. Sarah leads an organization that spans 14,000 clinicians, 24 hospitals, several hospice centers and outpatient clinics, and research facilities. She is a known leader in the industry and deeply committed to healthcare equity and to innovation. She has been named as one of the top 25 women leaders in modern healthcare and has also served on the governor's task force for the future of healthcare in California. Joining Sarah is Dr. Liz Villardo, who's the CEO of the Sutter Medical Foundations, including the Palo Alto Medical Foundation, a foundation that many of us here in the Silicon Valley are grateful for the care that they give us. Liz has been a practicing physician and a leading physician for over 30 years. She oversees more than 2,000 clinicians across the Bay Area, and last year they had more than 2 million patient visits. Liz is committed to her community and serves on many nonprofit boards, including the YMCA and the Silicon Valley Leadership Group. Moderating this conversation is Dwight, who leads the healthcare practice on the West Coast for RedHat. And we all know RedHat as the company in open source for Linux. Over to you, Dwight.
Thank you, Anita. Sarah and Dr. Vilardo, welcome. It's good to see you both. As a member of the community that you serve, I am honored and humbled to moderate this important discussion. So let's jump right in. We have needed courageous leaders this last year more than ever, and we normal. Share with us your journey and early influences that have given you the courage needed to lead your teams, your organization, and our community through these difficult times.
Well, I'll jump in first, Liz, and I got to say I'm honored to be here today and to share this time with Dr. Liz Villardo, who's just an amazing leader, an amazing physician leader, an amazing female leader. And I think we've both had interesting journeys that have gotten us here. You asked, what were the influences? What were the things that really shaped that? And, you know, I always start with how lucky I was to have parents that love me. Right. So one of my passions in life besides healthcare is ensuring that children don't emancipate out of the foster care system without a permanent adult attachment. And I think all of us have to start with how wonderful it is if we have parents who love us. And if they can afford to educate us, well, that's an even greater bonus. My dad was a physician. He was the child of immigrant parents, Russian immigrant parents. His mom was a physician who came to this country and worked in a laundry most of her life, never was even able to go back to school to become a nurse because she needed to support her children. And both my parents really raised me with a passion around giving back. My dad loved healthcare. He loved being a physician. He was in academic medicine and really believed in the mission of service and in doing good for the community. Early on, certainly never occurred to me that I would end up running a health system. You know, I challenge you to find a elementary school age child who says, when I grow up, I want to run a not-for-profit healthcare system in the middle of a pandemic, serve more of the poor than anyone else in our footprint, and yet still have people think that somehow we have infinite financial resources. So this is a very challenging job. And I think that what gives me the passion to do this role really goes back to the fact that first and foremost, this is an organization that's about people caring for people. And I was raised by people who that's what they did every day. And they did it under some pretty difficult circumstances. They had to face enormous challenges in their own childhood and early adulthood. And, you know, I try to remember every day to be grateful for the gifts that I've been given in life. And, you know, when I have days that are really hard, I go out and I round with one of our physicians, like someone like Liz. And, you know, when you reconnect to how amazing it is that our staff show up and they show love and compassion for strangers, and never have they been braver in doing it than they were during the pandemic. And it really re-energizes you to do what you do.
So I also want to thank you for inviting us here. It's wonderful to be here and to be with Sarah, who is an amazing leader, a mentor, and really mission driven. It's been so wonderful to work with her over the years. I would say that I've sort of stumbled into my career in a way, but it's been driven by a love for people and a love for science and change. So I joined the Army when I was 17. I was looking for a way to get an education. When I joined at the time, men were drafted and women joined to better their lives. Sometimes they joined to avoid incarceration. Sometimes they joined to learn, and lots of different reasons. In the military, I trained as a vocational nurse, a 91C, the equivalent of a vocational nurse. I fortunately did not see combat, but I certainly saw the terrible results of combat. And I learned an incredible amount about leadership, change, accepting new circumstances, and real resiliency among the people. Later, after I left the military, I continued in school. I got my RN and I worked as a nurse in a dialysis unit. I worked nights. I really loved that work because it was chronic care. I worked with the same people day after day. Their names are still written in my heart, like my family. And I went to college. I went to Sonoma State, which is just a little tiny school at the time. And I applied to UCSF, which had I known at the time, I wouldn't have ever thought that I could get in, but I was able to get in. That's a whole nother story. But when I entered UCSF, it was right at the start, 1985, the very beginning of the AIDS epidemic in San Francisco. None of us had any idea what was really going on. It was all about just figuring it out, swallowing our fear, and really having compassion for these people who had so many terrible problems. Later, I was fortunate to join a multi-specialty group, and I really saw the wonder of being in a healthcare system. That group joined another group, and then we joined Sutter, and really worked in a situation that was ever evolving and changing and growing and taking care of people. Really, as a physician leader, I think that you have to embrace change. You have to face fear, and you have to accept challenges with compassion and really holding people in the center. I think that's really what healthcare and leadership is about. Facing the change, accepting the changes, accepting the fear, like with the pandemic, but leading with compassion and taking care of the people.
What role will technology, digital health, and other innovations play in that recovery and our future preparedness?
Well,
Liz, why don't you answer from a clinical viewpoint first?
Okay. So when you think about it, medicine is all about change and innovation. I was fortunate to practice in the Silicon Valley, where I actually took care of farmers, Westinghouse engineers, silicon chip manufacturers, and internet entrepreneurs. So if you think about it, that whole line of change across the valley, and it's been the same way in medicine. Our group started as a small group of doctors who felt that if they worked together and shared resources, they could better take care of their patients, provide higher quality, and manage a population. That group grew over the years, joined other groups, and continued to evolve. So we were really ready for the changes that occurred with the pandemic. Our organization, PAMF and SutterHealth, has had the electronic medical record for over 25 years, and really capability to do things like video visits and others for quite a long time. What happened with the pandemic was really a silver lining, because the regulatory barriers that were hindering us and financial barriers that were hindering us were taken away, and we were able to expand telehealth, provide that capability to all of our providers within a matter of weeks. We had planned to test it over a couple of years. Amazingly, we went from 7,000 video visits a year in 2019 to over 1 million in 2020. It made the patients very happy. It's amazing. Their satisfaction with doctor listening actually went up with the video visits. So patients really feel connected on those video visits. Of course, obviously, there's more to the story of the pandemic and being in the system and innovation than just video visits. Our system was able to work together across our Northern California footprint. We shared resources. We shared supplies. Sutter redeployed its electronic ICU to small hospitals, giving more ICU rooms to the various little hospitals, making room. We doubled our ICU capacity to make room for patients who came with COVID, who were terribly sick. The pandemic really showed us that it's possible to do things very quickly when you remove that regulatory burden. And it also showed that a system of care really can provide great benefit to the community and to our patients by working together.
Yeah, maybe just amplify a couple of things that Liz said. Certainly when people talk about innovation during the pandemic, video visits, telehealth comes to mind rapidly. But all of that was really possible because of the infrastructure that had already been built that gave us a backbone on which to use that platform. And actually, the pandemic was not the first disaster that we used that capability with. It was actually the really tragic wildfires that Northern California has suffered over the last several years. And the first time I think we really saw this in action, Liz, was when your group stepped in and started seeing the patients from Santa Rosa who had, were in friends' homes, were in shelters, were in hotels, were scattered really far and wide. They needed their medications refilled. They needed their chronic disease management. Our physicians in Santa Rosa were dealing with their own life and family emergencies. And we had physicians from across our network step in. And we built on those learnings really to be able to pivot so quickly in the pandemic. We're so fortunate, we've got a lot of technology expertise, I hope, listening into this broadcast. And we are so fortunate to be able to partner, I think, with some of the most innovative minds in the world, entrepreneurs at scale, as well as people who are really at the beginning of their innovation career. And our goal is not that we have to invent it. We want to use it on behalf of our patients. And this is really all about how do we use the technology to accelerate our ability to be available to our patients whenever and wherever they with them. And technology can really be an enabler of making that happen. We need to do it in a way that enables our clinicians to still practice really good medicine and also have manageable personal and professional lives themselves.
Relationship. So how are you and your clinical staff thinking about finding that balance that operationalizes the real value from virtual care that we all know is there, yet retains that human aspect? So critical in that clinical clinician-patient relationship.
I talked a bit about science, innovation, and people. The ongoing relationship between doctor and patient is really essential for coordinated high-quality care. It improves outcomes and it saves money. An integrated system adds value to the relationship by giving the physician a team and resources that are not really available, let's say, in a single office, like the example Sarah gave about the fires and our ability to help one another. But there's a distinction between virtual care provided by a qualified provider and a long-term relationship where you can see the provider virtual or in person. So it's a no-brainer. If you have a small problem, a spider bite or something, and you have a quick problem, you can probably see any willing provider. However, when the care is more complex, like this is my 4th urine infection, maybe we should look at something else. Should we do something other than antibiotics? That really needs to be a relationship. As with any technology, virtual care is not the answer, it's a tool. How much care we give virtually over time, we don't know, we're still learning. As I said, obviously some things are done best in person, surgery, and some things can be done in person or over the phone, following up on high blood pressure or diabetes, for example. But really, virtual care, how much is done virtually, will be decided by the value given to the patient of that care. So how does the patient see that as a value? Is it easier for them to have a virtual visit? Does it feel more private? Is it more convenient? Or would they rather be in person and have that in-person touch? Right now, patients are sort of starved for contact and there's no traffic. So it's really easy to get to the office. And sometimes they say, no, I'd rather see the doctor in person. I suspect that as our world returns and traffic returns and soccer games return and all these other things, people will want more virtual care. I think our job is to find solutions to make virtual care better, both technical and flow solutions, how we do the job, and also figure out ways to decrease costs, increase safety. We have the opportunity to do hospital at home and other things with virtual care, and those really may be ways to, as I said, save money and improve safety. It's really about marrying that technology with people, with a team and a system.
I would just add a few quick things. We had a virtuous cycle during the pandemic where patients believed it was safer not to come into the office. Physicians believed that for some care, it was safer for the patient as well as for the provider. And we had a reimbursement model. But not all virtual care is equal. We have had a virtual first practice in place for some time. And that is not a practice that caters only to people with a simple problem or looking for a quick answer. We have some very complex, very fragile patients with chronic disease. It's care guided by the expertise of our clinicians based on the patient's needs. And that's really what it should.
To the clinician. So how have you addressed this fatigue that must be there amongst your staff and really kept the morale going during this really difficult time in our history?
Yeah, it's been an incredibly difficult time, I would say, for all of our staff. And, for that environmental services worker that has to walk into that hospital room and clean it, not understanding, none of us understood much about this disease early on, to the nurse, to the physician, to the laboratory technician who is constantly bombarded about turnaround time and shortage of tests, the fact that our supply chain was interrupted, and people took this responsibility so seriously. I just can't say enough about how seriously they took this responsibility. We had already had a lot of focus on mental health and employee and clinician well-being. And so we built on the work that was already done. But really, we had to kind of put it on steroids. Our employee assistance providers moved into some of our facilities, and we augmented them with additional help. We provided support not just to our clinicians, but also to their families, not just to our staff, but also to our families. If people needed it and wanted it because they felt it was safest, we provided housing, we provided transportation. We wanted to be there for them if they were struggling with problems with schooling their children at home or dealing with anxiety and depression with a spouse. So we did everything we could to build upon what we already knew and to add to it. And it has still taken a toll. I would just mention one other thing that's taken a toll, and we haven't talked about it enough, is all of the issues in health equity that have come up. For some systems newly with this pandemic, it's an issue our system has been working on for some time. And I would tell you, I think our clinicians have felt a special responsibility of how to address that, and also how to support their colleagues who may be dealing with their own issues around inequities in this. Because for some of them, the most impactful moment was the murder of George Floyd and not the pandemic. And we can't forget that this pandemic and the events in this country have hit everyone in different ways, and we need to be very sensitive and supportive about that.
A few things, clinician burnout is a massive challenge in this country. Started before the pandemic. We were concerned about the growing physician shortages. We already face significant shortages in primary care physicians. Certainly rural and inner city areas are short of physicians. They think there'll be about 35,000 primary care doctors short and 60,000 specialists by 2025. So we've been addressing joy of work and resiliency as an organization for quite some time. I've been impressed with the work that Sarah has really championed to help our teams to find joy in their work and to really connect. The pandemic, interestingly, has in some ways helped. It brought the opportunity for people to truly make a difference. It brought around opportunities for innovation that were unbelievable. It helped them drive forward with their work. And then when the vaccine came around, the ability to vaccinate was and
partnerships. As strong recognized women leaders in our community, what lessons and advice can you share with our audience, especially those wanting to enter healthcare as a professional or entrepreneur?
Certainly, we've talked about having a team. And to have a team, you need to be authentic. You need to be vulnerable. You need to lead with humility, really understand that everyone has a voice, and you need everyone to make a difference.
Yeah, I would just add that trust is at the core of the most important thing that we do, which is our patient care. And everything that we do as leaders should be built, I believe, in authenticity and in service to that mission.
Well, Sarah and Dr. Vilardo, thank you so much.
Thank you, Sarah Cravens, and thank you, Dr. Vilardo, and thank you, Dwight, for a great session on how our providers dealt with the pandemic.